going to show some PDO threads. We're using Princess PDO threads, which are distributed by Shuko in the UK. They've got a whole wide range of different threads. They've got monofilaments, they've got screws, and they've got barbs. What we're looking at today is the bread and butter of what we do with PDOs, and that is, if you turn your head for me, and we can see that she's got a little bit, and I mean, you know, she's doing very well, aging very nicely really, but she's got a little bit of a jowling effect down here, and you can actually see where the cheek has started to slip down a little bit. This is what generates your nasolabial folds. It also generates your marionette line. So yeah, we could just go in with a little bit of filler. We could probably put a little bit of augmentation in the mid-face, which would give you a certain amount of lift. Procedure's not particularly uncomfortable. I use anaesthetic. I pre-infiltrate the cheek with anaesthetic first, just using a cannula and 2% plain lidocaine. Generally do about 2.5 mil per side, normally about half a mil of local anaesthetic per thread. You want to be going into the subdermal tissue. You certainly don't want to be going too superficial with these. They will cause some puckering. You'll see them through the skin. It'll cause some kind of inflammatory reactions there. So make sure you're happy with your depth. You okay?
Yeah.
Okay, so we're at the very end now, so you can just feel the tip down there. Like I say, what I tend to do is just push the skin up a little bit, push the needle down, which this is the worst bit, and give it a quick pull, and then I'll just give it a twist and walk it out. So we're right to the nasolabial fold there. I'm just going to give it a slight more edge, give it a twist, and then I'll just walk it out. And that's all the threads in there now. So exactly the same procedure on the other side. Well done. So a little bit uncomfortable just as we're at the very edge of the jawline. Push up, give it a rotate, walk it out. The way we do this is I'll just put a little bit of arnica cream or whatever you like to use, just so you've got something so you're not causing friction and trauma on the skin. Just pick up the threads with a pair of forceps. Just give that a little twist. And then basically I just pull it in the direction the thread's gone in, and then tighten them. So I want to tighten this one first, so I'll pull this direction, push the skin against it, push against it. The way that you do it is you just pull up, so you tent the skin quite nicely, pair of scissors, push the skin down, give it a trim, and then if you give it a little touch there, you can feel them that they retract under the skin very nicely. I don't know if anybody can see any results yet, but yeah, obviously the right side's been lifted up. Just 4 PDO threads. Fairly simple treatment there. So again, you'll see if I just give it a little bit of a pull there, you can see the movement where the threads were attached. So I'm okay. Like I say, this bit's a little bit uncomfortable for them. I'll ask you in a second when I finish pulling, but you'll actually feel when you do this, you sometimes feel like a little bit of a pop, pop, pop sensation. And I think patients tend to feel it in the skin as well. It's absolutely normal, but you know, can be a bit of a funny feeling. Okay, so again, I don't know if people can see that, probably a bit far away, but you've got about an extra 10 mil to what I started with there, so you can see that we've had a degree of lift there. Again, pull up, perpendicular to the skin, push down, trim, little touch there, you can feel it all retract nicely. But I'm also hoping I can get a bit more collagen around the barbs that I've already put in. So if you can get these barbs that have come in here and get some collagen over the top of them, I'm hoping it will just strengthen and increase the longevity of the actual barb treatment, the lifting treatment. Well done.